Hi, I'm back. Just finished with all my patients. Long day, back to back patients, just as I like it. Have some notes to fill, but yeah, let's continue with the continuation of my experience video. So I think I was on the spot where we had paused. I told you all that first I started with the putty and then I started with the Caries task while it was set. See, normally when I used to do my Caries task, I used to just take 30 to 40 minutes, not more than that. But I ended up taking 1 hour for that task, So sometimes unexpected things can also happen. And why I took 1 hour? Because in the starting first half an hour, I was just trying to get acquainted with everything. Like, I had taken out all the stuff, I had arranged it neatly on my trolley and my bracket table. But I had to go again and again for the putty, you see. And there was a line for the putty also because everybody else was also asking for it. And since I was the candidate 9, I was a little far away from the table where all the stuff was kept. So you have to give yourself that thing because of course you won't be aware. And I was taking extra time just to read all the tasks to make sure that I'm not doing any mistake with the tooth. So the first 1 hour would go a little more slower with any task that you're doing because you're just trying to make sure that whatever you're doing is right. You're taking up things properly, you're keeping it properly. So start with the KV's task. Because you can stop that in between, then again go for the putty. Now, whenever you go for the putty, also take in alcohol swabs, those wipes, alcohol wipes, because they just give you two to start with and they just get over like this. So, whenever you're going to get anything, just keep on asking the dental assistant, and she will give you just two at any given point of time. So, you need at least 8 to 10 of it to clean and for various other tasks, and for caries also. So the Caries task, we'll discuss the Caries task in detail. But by now, if you have been practicing, you know that the troublemaking spots are below the mesiolingual cusp and the mesiobuccal cusp. You have to see from various angles, and your eyes get tired so many times. And you have to take that alcohol. So what you do is you take that micro brush you have, and you squeeze that alcohol, wipe over it, so alcohol drops come on that, and then you clean, and then you keep on watching. Treat Caries like your ex, you are not with them, but you keep stalking them in between on Insta or Facebook just to see what's happening with them. So what I mean is, even if you're done with the Caries task, you are definitely never sure if you have removed all the Caries from all the spots, because you cannot remove the jaw when you're practicing, and not in the exam that you can see which angle, the Caries is left behind. You have to see with the mirror, and after a while you just stop seeing because it's so bright. You can't just see that tiny black spot of Caries. So you're doing some other task and you're in between, just come back with the mirror and again double check. Because in Caries task, it's okay to overextend a bit. But it's not okay to leave the Caries, because if you leave Caries, you straight away fail. So might as well go in the satisfactory or the borderline criteria than in unsatisfactory by leaving the Caries behind. So if in doubt, just drill that area a little more if you want, but don't leave the Caries behind. So in between all the tasks, keep going back on the Caries to check. Hence also you start in the first. So by the time your three putties would be made, and make sure they are done really nicely, and keep the one which you think you will be using for your provisional on the side. Try not to drop that, keep it really on the side and make sure it's well protected. And you are doing your Caries and you finish your Caries. So I took full 1 hour to finish my Caries task, and then I left it there after cleaning it properly. And then I started with my endo. So I have loops and I have the loop light also, and the loop light kind of becomes heavy on me. So, and I didn't want to remove it again and again. So I wanted to finish Caries and endo, the main tasks for which I use the loop lights. Because endo is one task which as much brightness as possible is needed because it's such a minute task. If you have seen my endo video, you know how tiny that cavity is and how minute details you're supposed to take care. So my tooth number was 16, so I started with my endo and I finished it in 25 minutes. The tooth was really nice and the task went on smoothly. And once I finished with the task, then I went ahead, I removed my gloves, I did my hand sanitization, I removed my loop light, went and kept in the third shelf of the drawer. So the drawer that is being given to you in my previous video, I showed you the drawer. The last shelf is for your loops. Nothing is kept there. So I went and kept there with my bare hands because I've just removed it and I can touch my loop light with my bare hands. I kept it. I went back again, sanitized my hand because this is the protocol you're supposed to follow. Don't try to cheat through. Don't, even if you are on not on time, it's okay. Just follow your protocol. I again took another pair of gloves. I came back, and now I started with my amalgam task. My aim was to finish at least 3.5 tasks before the break time. So 9:45 we started, 12:45 was the break time, and then we started again at 1:30 and we were supposed to finish at 4:30. This is the timeline that they will follow. So now that my endo task was done, I again put a little bit of alcohol cleaning in it and I started with the amalgam. Why you should try and finish amalgam in the first half is because, see, you can correct it if it's not done properly. And also, when you'll be doing amalgam, certain things here and there, amalgam is going to fall in the mannequin. Now, when you'll be doing the other tasks, you'll be anyways putting a lot of water, so those things would get drained off. You don't have to specially waste your time in checking where else the amalgam has fallen off inside the mannequin and drain it. Though, while doing the amalgam task, you should put 5-6 gauze pieces below it. And since my tooth number was 2-6, I put a lot of gauze piece below it because there are high chances of falling from the up to down. Though in my case it did not fall the entire chunk of amalgam. Scraps when you carve and all, some things come off. But then that gets washed out when you're doing other tasks. So you don't have to specifically waste time. That is also one of the reasons you should start with amalgam. Also, one thing that I forgot to mention was when I'm doing the putty, and the first thing that I started in the mannequin, the first thing that you should do and not forget is make grooves over the amalgam cavity and the composite. When we'll be talking about those tasks, I'll tell you, the first step is always to make grooves because it's a very smooth surface tooth. If you don't make those grooves, your restoration will come out while polishing. It will just, the entire thing will come out because there is no grip to it. So you have to make small grooves and holes in that prepared cavity so that there is some retention feature out there. So first you have to make grooves and then I started with my caries task. Yeah. So since I had already made my grooves, I didn't have to touch my handpiece and so I have not put a burr on it. And now I have assembled everything for my amalgam. I've put a retainer, I've checked it, I've put a wedge properly. Now in my exam, the amalgam was very, very fast setting and that gave me a bit of a trouble. So you'll be given 3 amalgam capsules to start with. You cannot take more when you already have 3, but you can take more if you would like. So I took 1 capsule and the amalgamator was kept. There were 3 amalgamators kept throughout the exam. One was diagonally opposite to me. So in the amalgam task, you're allowed to leave the light open. You're allowed to leave the patient recline and you're allowed to leave the retainer in the mouth. Otherwise, normally when you get up to get anything, the light has to be closed. Okay. So I went for that and 8 seconds are already set in the machine. You cannot change. You should not change. If you change, you would be charged with misconduct. So in case accidentally you change the setting, you call the examiner, but you don't change yourself. Remember this point. So I went, I did the mixing of it. I came back, I removed, I took the entire chunk and I put it with my tweezer. And it was so fast setting. I barely had time to condense it and it was setting. So this is the problem that a lot of other candidates also had when I spoke to them after the exam, that did you find problem with the amalgam? They all said yes. So because it was so fast setting, carving was very difficult, but there is a way to go about it. So I'll tell you about it. So I did my amalgam tasks. I made sure that I had built up at the cusp height properly. I had the cavity which was quite huge, MOD, that means both the ends are missing and the mesobuccal cusp is off. So building the cusp is the major thing. So I built up my cusp nicely, I built up the marginal ridges and everything, but I did not have enough time to carve because it was already so hard set that no matter how much I scratched, I just could not get it through. So a basic anatomical outline I had given, but I was myself not satisfied with that because I wanted to give more depth and detail to it. So I left it at that point. I didn't want to bother because I knew I had to start with my crown cutting. As again, I didn't want to keep it completely after the break because that is also time consuming. And I didn't want to waste more time in amalgam right now because whatever I had done right now was sufficient enough, but to come into better grades, I needed to, finish it a little better. So I removed my retainers and everything, and I left amalgam whatever it was. I had built up the proper cusp outline, but the occlusion details I still had to finish a bit better. So as of now, I just left it. I started with my crown prep 4/6. So it was half an hour to go for the break. So I did my occlusal cutting, I did my buccal, I did my lingual, and one side proximal I finished, the other side I still had to finish. When the warning sign came that 10 minutes are remaining for the break time. Now, when the examiner says that, don't keep on working. You have to be respectful towards their break time because they will not like it if you continue to work until the last bell goes and then stop everything. Because when the warning comes, you should stop working. You should remove all your burrs, keep it in the burr box, close it. You should remove all the instruments, put it in the cassette box, and close that box. Okay. Now, there'll be two cups in which one is for the amalgam, the capsules and the scraps that you will put, and the other is for the sharps. The sharps are your wedges and your discs. Now that is a very light-weighted cup and it can easily fall down. So before the break, you make sure that you put that amalgam capsule dispenser cup that you have on top of the glass of your this thing sharp. So on one on top of each other basically, and so that it doesn't fall off. And then you upright the patient chair, you close the light, you move the bracket table away, you remove your then you go remove your gloves, you do your hand hygiene, sanitize, come back again, take your loops, keep it in the last drawer, again go back, sanitize your hands, then remove this PPE, fold it nicely, put it over your chair. In this, all 10 minutes will go, and then when the time is over, it's bang 12:45. She would be like, leave the examiner. At that time, you should not be doing all these things. They won't like it. Okay? So make sure that those 10 minutes you do all this. So the moment she says leave, just leave. Go to your candidate lounge. Don't talk. Everybody has got the same task. There is nothing to talk. So sit, have your lunch, close your eyes, relax, do a bit of stretching here and there. There is a prayer room. One person is allowed at one time, so you can go and pray if you would like. Go to the washroom or wait until 5 minutes are remaining before you are asked to go back inside and start working. Go to washroom at that time so that you can manage the 3 hours without it. Drink plenty of water, keep yourself hydrated. Your brain needs oxygen and water to work also. So I did take a break in my first 3 hours. After 2 hours, I took a break for 10 minutes. I just went outside before I started with my crown cutting. I was like, let me just roam around and come back because eyes get tired. I had done caries and endo and I just finished with amalgam. And I was like, I need a 10 minutes break. So I went outside, had some water, came back. It's okay to go. You should go because it relaxes you. And then I started. Now, in the second part of the exam, when I started, first I finished my crown prep, and then I did not jump immediately to make the provisional because once you are working on the crown prep, you check again and again with the putty index and all. Again, you stop seeing things, because you get tired and exhausted. So I kind of, once I was done with the crown prep and I was satisfied with it, I just stopped it. I went on to the composite. I had one and I built up the composite. Okay, the basic thing with the matrix band and everything, and I removed it. I did not polish it. I'll tell you why I did not polish it right there and there. So I finished the basic composite task and it's all bulky from everywhere. Now again I checked my crown and I polished it, and now when I was satisfied that I'm ready to go with the provisional, And yeah, one thing in the exam for crown preparation, they mention that your finish margins should be zero point 0.5 millimeters above the gingiva. It is always supragingival. When you're practicing, do not make it equigingival. Always, always zero point 0.5 mm supragingival. In the exam, they ask you to do that. They have specifically mentioned it. So keep that in your mind. Why am I saying is that when I used to practice, I used to make it supra or sometimes even equigingival. Don't do that in exam. They have specifically mentioned they want zero point 0.5 mm supragingival. So you have to do that. So anyways, so now that I was done with the basic composite, now I went and asked her for the Pro Temp gun, took it, bleed it really nicely, and put it in your putty. After applying Vaseline on your teeth, and then put it over your this thing. Yeah, we'll talk about the task. So I've put the provisional, and I didn't want to sit like that while it was being set, and I wanted to give it a good 10 to 15 minutes before I removed the putty. So I didn't want to waste the time, so now I started polishing my composite. You see, so this is how you manage your task without wasting your time and giving it ample time to set, because provisional is such a thing. If it comes good in one shot, your life is so easy. Otherwise, if it doesn't come out properly, then oh my god, you have to make it again, and the whole sort of process, the entire duration that you spent on the first provisional becomes a waste. So I really wanted my provisional to come out very nicely, so I gave it ample time and I did it very nicely. So the putty is still there with the provisional inside it, and I'm allowing it to set for a good 15 minutes, and in the meanwhile I started polishing my composite. So I'm not in a rush now or eagerness to remove the putty because I'm already doing another tasks, right? So I'm polishing my composite, and in the next 15 to 20 minutes I finished its polishing, and I was pretty satisfied with the outcome of it. So now the time had come to remove the putty. So I removed the putty, and thankfully the provisional had really come out nice. So then I removed the provisional. Now while removing the provisional, make sure you have put a lot of gauze. Happened with me. I removed the provisional, it went inside the mannequin. But it was right there, so I could retrieve it with my tweezer. But yeah, keep a gauze. And then I took the provisional, and I polished it. Once I was done with the polishing, I did not put it back on the tooth because I didn't want to damage it or have amalgam touch it and distort it. And you have to wipe your provisional a lot with the alcohol swabs to give it a nice glaze. And if the provisional has come out really nice, you don't have to actually polish a lot. It's just the proximal surfaces that you will be polishing and the cervical ones. And check with the floss. 20 minutes, you are done. So once it was ready, I took that provisional and kept it on my trolley, and I kind of covered it with a glass or something so it's safe. And I didn't make another one. Like I was like, I'll treat it very preciously. This is my only provisional, and it's come out nice, so I didn't feel the need to make another one. Now I had almost 1.5 hours left with me. So now I went back to the amalgam, and I removed the center portion of it. And once I removed the center portion, I again took a new capsule, I mixed it, and I directly placed it, and I started carving. Even then it set so fast, but at least I had enough time to give the details that I wanted. So I did not remove the cuspal area or something, it's just the occlusion part of it, and I didn't need any retainer now because all the walls were built, the marginal ridges were fine. It's just the center part where I had to give the oblique ridge and the transverse ridge and the those triangular fossas near the marginal ridges. So once I was done with that, though I wanted it to be a little more nicer, but the amalgam was setting so fast, I really didn't know what I could do more. So I did that, and I was like, okay, satisfied with it. So I left that. And then again, I went back and checked my caries, I checked my endo task, I finished a little bit more on my endo task. I didn't want to touch my composite again because it was fine, and sometimes you feel, okay, you know what, let's do this and let's do that, and you end up damaging it more. So I was like, Garima control, this looks satisfactory according to all the criteria. Each task you will you have by now memorized all the criterias in your head. So I checked every task with the criterias that I remembered. And once I was satisfied that I had done everything, I stopped. Now I cleaned my entire mannequin and jaw. In the second half of the exam, I did not drop anything. In the first half, I dropped the three-way, the handpiece, the gauze. Wow. So in the second half, I did not drop anything, and around 4 o'clock, I must have finished everything. So now I was just cleaning the mannequin, and there is a high vacuum suction also. You can take that, and I recommend you take that. I was putting a lot of water everywhere and cleaning. And once I was done with that at around 4:10, I kind of stopped and I was like, I will not do anything more, because you feel like, let's do this, let's do that, and you end up damaging more. One of the candidates did say, when I met him after the exam, that in his overzealousness, he was flossing so many times during the composite that the entire composite restoration came off. Then he had to do all over again. So don't give yourself that stress. If it's passing, it's just fine. Just leave it right there and there. You don't have to make it look good. You have to fit the criterias. So once all is done, then I called the examiner and I told her I'm done. So she came, she checked, she asked me, were you able to finish all the tasks? And I was like, yes, I did. Then she took a tape and put it over the provisional over the tooth, and that's it. Make sure your mannequin is clean from inside. There is no scraps, there is no debris, nothing there. Now, when that was done, now the time comes for you to dispose of the things. So the amalgam capsules are to go in a separate box where they have kept. The gauze piece in which the amalgam is there, which you have used to clean, goes in a separate container. Make sure you follow that. The sharps means the wedges, the matrix band, the discs that you used, the scalpel blade that you have used, all goes in the sharps container. Now in the exam, like this is the bracket table, right? On this side, they have a garbage kind of a bag that they have put. You can put your cotton and gauze in this. Do not put your sorry. Do not put your wedges or discs or anything else in this box or even amalgam. They will check that. That doesn't go here. That goes in a sharps container which they have kept near the sink. Understood? So again, we'll talk about in detail in the infection control. Infection control is a very major part of the exam. Even if you clear all the tasks and you're found fail in the infection control, you fail the exam. And this is what happened with a recent prosthodontist who's also in Dubai, and he passed in all the tasks, but in infection control in the LA task in the skilled OSKI he failed. I asked him what happened. He said he followed everything properly. He also doesn't know in what basis they have failed him in infection control, but he failed the exam, which is very heartbreaking. Even I don't know if they will fail me over that, because I have followed all the protocols, but they don't tell you at which step you made a mistake, right? That is the biasness of the exam, and that's why that luck factor comes in. So, anyways, whatever happened will happen. I'm satisfied that I gave my best and did whatever I could in whatever circumstances I had. So, anyways, yeah, we'll talk about infection control in detail later. So once I was done, then I just left everything there, and she was like, okay, you can leave. It was just 10 minutes remaining for it to finish. It was 4:20 and 4:30 about to finish, and only the warning bell had rung that only 10 minutes are left. So again, I washed my hands, I followed the hand hygiene, I removed my PPE, I disposed it, and then I took my loops and I left the lounge. I left the area. Then I was made to sit in the candidate lounge, and then another person came, and she was like, you can leave now. So I took my stuff and I left. So that was my day one of the exam. Pretty smooth. I was happy. I wasn't stressed. I was working nice. I knew what I was doing as I practiced, so I felt confident. That was day one of the technicals. Now, day two, my exam was in the afternoon session, and that was a bit tough and challenging because we have 10 OSKI stations and you do get 2 breaks in between. But it's so back to back that you barely have time to think. So you have to have practiced all these things multiple times because you don't have time to think at all. out there. So again, you're ushered in on day two. They check your registration, whatever, and they usher you in. 1:15 hour session started, and so there are 10 rooms. You enter in a hallway. On the left side, they have 6 rooms. They have labeled 1, 2, 3, 4, 5, 6. On the right side, 7, 8, 9, 10. And 6 candidates are there. And they have kept a water station there where you can drink water. And I recommend you drink it after every task because there's so much to say in the communication OSKI. And in the skilled OSKI, you have to perform and think so much that drinking water is kind of refreshing. So take little water and after every task drink. So how it goes is you are allotted 15 minutes for each room. So, and you have this, what do you say, label out here which has mentioned your schedule already. That from 1:15 to 1:30 you're in room 6, from this thing, 1:30 to 1:30, yeah, 1:15 to 1:30 you are here. Then 1:30 to this you are there. 1:30 to 1:45 in your room. Mine was 10, and then you have a rest time. Then again you are in these many rooms. So for me, I had 5 rooms back to back, and then I got a break. And then I had 3 rooms, and then break, and then 2 rooms. So in the start only, I had 5 rooms back to back. So it was a little challenging because others got break in between them, but I did not because that was my schedule, which was okay. So you are supposed to stand outside your room, and when the bell rings, you have to go inside. Now in the communication OSKI rooms, 1, 2, 3, 4, 5, 6, the first and the second room are always information gathering. The third and the fourth rooms are always diagnosis, and the 5 and the 6 rooms are treatment clusters. I came to know this 2 days before the exam, imagine. So yeah, it is like that. 7, 8, 9, 10 are the skilled OSKI rooms. So now you have to have this eyewear, which you are going to need in your skilled OSKI, but you should not take in your communication OSKI because accidentally if you forget on the table, you cannot go back and retrieve it. And you need to have this for your skilled OSKI, like a safety eyewear, which you'll have to carry by yourself. So you keep it outside the communication OSKI room and then go. Don't take it along with you. So in room 6 when I entered, that was my first station, and that was the station where I had the examiner, which was very rude, mean, sarcastic, and she was horrible basically. But the other candidates told me that she was also like them with them, so probably she was playing a role play. But wow, I mean, I never encountered such a patient in my life because everybody is always respectful. They may be angry or upset due to some reason, but nobody is sarcastic, mean, or arrogant, you know. But anyway, she was that. So I did my case. I will discuss in detail which communication cases I've got because otherwise this video will become way too long. So initially when you enter, they will check your ID, check it, put it back inside, sit. There's a big screen on that and the entire scenario is mentioned. Now very importantly, do not get stressed because if you just focus and you have 3 minutes and the timer is written there. If you get stressed, you will read that and you will start making your notes. You will forget to read the medical history which is kept on your table. It's not there on the screen. And tiny things are written. But I remembered that I have to read the medical chart because I had practiced my communication OSKIs almost 4 to 5 months. So I knew this needs to be done. So even before I started reading the scenario, I read the medical chart first. And on the medical chart, it was written that she had a hip replacement and she is allergic to penicillin and whatever. So I knew the medical history because a lot of people, I mean, experiences that I've heard of the candidates, they have forgotten to read the medical history, which deducts your marks because then, you know, she's observing you in the 3 minutes what you're doing and she'll trap you somewhere. I read the scenario, I made my notes as to what all questions I wanted to ask. And see, the way I've learned my communication OSKI and the way I know should be done is you have to have an eye contact and treat her like a patient and you are the doctor. So don't start writing if she's saying something or don't have your focus on your notepad when you're talking to her, You know what you have written, you had 3 minutes, you have practiced and that's why you have to manage those 3 minutes very well. And then I just keep my pen down and I'm just talking to her like I'm talking to you. So this is effective communication. You are giving her attention. You are not focused on a script. You know what questions you have to ask, but you are okay to adapt and you're okay to mold yourself if she gives you something new which you don't know. That's effective communication and not a script, which is very important. So I'm talking to her and I finished my case. Whatever concerns were there, I try to address that first because that is what the question has asked. Manage the patient concerns and provide the treatment plan and gain the consent. So that is my priority. So wherever she is going, I'm trying to answer her query and get her back on the topic. So that was it. I did that, but I didn't like the way she spoke and the way, kind of my morale was a little down, but then I was like, it's okay. I'll go with a fresh mind in the next room. Now, once those 13 minutes are over, I'm outside and I just have 2 minutes before my next OSKI starts. So, in these 2 minutes, I have to go and stand outside my other room and I also have to drink water and I have to calm myself down and be fresh for the next room. So it's 15 minutes for one station, 13 minutes in which you'll finish the station, and 2 minutes you have to go and stand in the next door before the next session starts. So I had 5 of them back to back as my first thing, okay. So after room 6, then I had room 10 where I had this thing. What I had subgingival scaling, yes. So now when you enter the OSKI room, there's an examiner which is standing at the corner. There is a mannequin and there are instruments kept on the side table. We'll discuss in detail about the skilled OSKIs later on. How and where what stuff is kept and in which OSKI you are supposed to pick up what. But anyways, when you enter, there is a screen on the top right and there is a scenario given. Again, you have 3 minutes. Now you have to manage this 3 minutes really well. You will finish reading the scenario in 2 minutes, less than 2 minutes. In the remaining 1 minute, what you should do is you should go and adjust your chair. You tell her or the examiner, can I adjust my chair? She'll allow you because your hands are clean at that time. So you adjust your chair. You go and do not touch the instrument area and just have a look what all is kept, and you start thinking in your mind what all you have to pick up. Now in the scaling thing you don't have to pick up anything because I'll tell you why when I shoot the video for that. And you check the mannequin and you just see the area and you just fix in your mind the quadrant that you're supposed to work. For me it was 3-3 and 3-7 and the subgingival scalars were on the table. And there was this nice trick that they played with the subgingival scalars. I'll tell you when I'm shooting the subgingival scaling video. Just to fool the candidates, they have kept Gracie Curettes and the Explorer, which look exactly the same, but there is something written on it which makes you aware which is the subgingival and which is not. I'll tell you about it in the other video. So anyways, now once you're done with this, the moment your 3 minutes are going to be over, go and stand next to the sink. Don't waste time there. Just stand right next to the sink. So when you had entered this room for your exam, you have kept your eyewear on top of the sink. And now your time is about to start, so you go and stand right next to the sink. Once the bell rings, open the tap, wet your hands and take a little bit of soap and you do your hand hygiene 40 seconds, not less. This motion, this motion, this motion, three times each. This motion, this motion, this motion, like this. 40 seconds should go. Once you are done, take a paper towel, close the tap, not with your hand, with a paper towel. Take 3 paper towels, wipe your hands. Take the eyewear, wear it. Hands are clean, sanitize again. Go to the counter where you're supposed to pick up instruments. Now in the subgingival scaling you don't have to, but otherwise in the other tasks you're supposed to pick up the instruments which you're supposed to use, come and keep it on the bracket trolley. Go back, sanitize, wear gloves, come back, with your body sit if your task requires sitting, no touching the chair. Now you will take the light, adjust, recline the patient chair, get the bracket table. Again, look at the screen and make sure you're going to take the right quadrant. You touch the wrong quadrant, you fail. Okay, so see the right quadrant, 3-3-3-7. Take a mirror check. Then be calm, I took my periodontal probe. I did the probing. Apparently, I'm told that that gives you extra marks. I did it. Then I took the subgingival scaler because I had to read it properly because they looked all the same. Then the right number I had to take, I had to see the cutting edge. Subgingival scaling is easy as such, but you should know the right things. You take up a wrong instrument, you put it in the wrong way, you are asking for failure. So I took the subgingival this thing 1 and 2 because I started with the canine first. Did my scaling strokes properly. They are checking the way you insert, the way you do the strokes. You don't have to remove the calculus. There is a black nail paint out there which is calculus. You don't have to. You have to just show them the strokes. Some people start removing the calculus. No, you just make a motion. It's okay. 4 strokes on each side. 1, 2, 3, 4 in one tooth, and then 3, 7, 1, 2, 3, 4. Around 7 minutes had gone. I kept the scaler properly back in the cassette. I closed it. Removed the bracket table that is taking out of danger. Closed the light. Uprighted the patient. Went, removed my gloves, washed my hands, sanitized, removed my eyewear, kept it on the sink. Again sanitized, and then I went back and stood and waited until my time was over, which was just 1 minute left. Do not drag yourself till the end of 10 minutes, because if you do and the bell rings, the examiner would just say leave, because they have to prepare for the next candidate and they also have 2 minutes only to prepare. So they would be very pissed off and angry if the bell has rung and you have not gotten up and left by that time, and she won't be talking to you all this while. So you make sure that you finish well in time and keep a check on the timer. Once the bell has rung and you have still not finished your work, just get up, throw the gloves and leave. Forget about putting the patient upright back. Of course you will lose your marks in that station, but at least something would be scored instead of you getting 0 if you fail to leave during the allotted time, or if you fail to do something else. So make sure your time is well managed and be very conscious of what you're doing, because she's observing each and every one of your steps. So that was my second station. My third and fourth stations were again communication OSKIs. So you know how exhausting it was. Again, back to back 10 minutes watching, writing, speaking. And then again I had a skilled OSKI, which was X-ray. No, X-ray was for me after the break. So after, there were 4, right? LA, subgingival scaling, extraction, and X-ray. Yeah, right. So I had LA was my last station. X-ray was after the break, and no, I did subgingival scaling, and then I had X-ray after the break. So LA task was there. Yeah, LA was there for me after that. Yeah, in the first 5 sessions, LA. So LA I'll discuss in detail how the station was, but pretty much the same thing. You enter and then you see. Now in the LA task, always remember that they have kept MEMS book, TG, and the medical chart of the patient. In the first 3 minutes, you read the scenario and never forget to read the medical chart. You ask the examiner, can I read? And she will be like, okay, you can read. Then you should touch the medical chart. Because if you're so focused on reading the scenario and you don't read the medical chart, you are in for a trouble. You know, in my patient, what they had given, I read the task, blah, 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 1 has to be anesthetized. And on the medical chart, it was written the patient is allergic to adrenaline. So adrenaline was there, and on the right side, tick was there that the patient is allergic to it. Now, if I don't read that and I pick up xylocaine, I fail, the cartridge. So, of course, you have to go with Citanest, that's Felipressine, and with Pralocaine. So, yeah, you should read the medical chart, and you're supposed also to act. The patient was taking Nardil, which is a depressant. So you're also supposed to act as if you don't know what that is, and you open the MEMS, you see in the index, open and just pretend to read. She's observing you. So you do that, then you go assemble and then come back. I'll tell you in another video what to assemble, how to assemble, what to take for which task, and which are the different scenarios that can be given. For me, the scenario was I have to anesthetize 1-1. You can get a scenario where you have to anesthetize 1-6 or 3-6 or 4-6. So once the LA task was done, then I finally got a break after 5 tasks. In those 15 minutes, I just sat. I went to washroom. and I just had hot water a bit, and then again I had three stations. In that again I had two communication OSKIs and one task, and that was X-ray. X-ray for me was a right side wake pain, which means I had to take a bite wing. So I had assembled everything and I've put the bite wing, and she asked me to show the exposure also. So I'll tell you and I'll draw in detail and show you what exposure buttons are there in the exam and what you're going to say. And after that again I had a rest break, and then I had another skilled OSKIs, and which was extraction. I had extraction of 2/6. So picking up the right forceps becomes very important. The way you hold, they just wanted to check how you hold before putting the pressure. So that was, I'll describe in detail each task and what they're looking forward to. So that was my communication OSKIs and the skilled OSKIs. And once I was done, it was 4:15 already. Everybody had finished, and then we just left, and my day was over. So I felt very relaxed and relieved once my day was over. I went back, and what I did, I preponed my ticket. So I was supposed to fly on 17th night, and I called Emirates and I'm like, please, I want to go home today itself. I don't want to stay here because I was missing my son so much. And they were happily enough, they had a seat, and the flight was full, and still they could manage to get me a seat, and I preponed my ticket. So my flight was at 9:15. I reached home at 4:45. I just packed. 5:20 I was down at the reception doing a checkout. 5:30, 5:40 I got my taxi. 6:20 I was at the airport. And I was like, finally I'm going home. So one day I had paid in Pegasus extra for the night stay. I'm like, you know what, you all enjoy. And I'm just leaving. So I left. So that was my trip, and I was happily back here the next day, valuing Dubai a lot more, because I really missed Dubai and I'm valuing it a lot more. I mean, Melbourne is nice, but Dubai is my home now, and it's much nicer, I have to say. That was my exam experience, guys. Any questions, leave in the comments. I will describe each skilled OSKI in detail. I'm tired while talking now. So, yeah, that's it. Thank you.